Morning, the 15th day of May 2018 it is. My name is Samuel Njoroge, and it's a pleasure to have you join us for Health a Tuesday this week. Our topic of focus will be health of the liver. How do you take care of it? Because life and your health is like a giggle process. What you take in affects what comes out. But most especially, you need to be in charge of the decisions that you make. Yes, there is a section of the population that, cannot help and diseases or circumstances happen. But again, to some large extent, you and I can do something to ensure that we improve the quality of our lives. Talk to us through the hashtag Good Morning Kenya on Twitter. 22162 is the SMS line. Begin with the initials GMK. I've got the pleasure of hosting two gentlemen in studio with me. I'll begin with the one that is seated to my immediate left. That is Dr. Dunstan Achwaka, who is a medical doctor. Welcome to the program.
Thank you.
Pleasure to have you. And to my extreme left, I've got Mr. Shiranda Achwaka. How are you, sir?
My pleasure.
I'd like to begin with you, dietary.
Yeah.
If you ask a majority of people what is the liver, there's a temptation they'll give you a vernacular interpretation or the vernacular name of the liver in their community. However, what is the liver and what function does it perform for the body?
Thank you, Sam. That's a very good question. Actually, the liver is one of the largest organs that we have in the gastrointestinal system. The liver is anatomically placed on the right side of the body, right under the right lung, and takes the space, just above the right kidney on the right side of the torso. The liver, all animals have a liver, and so is the human being. And the liver carries out several functions. So it's a very important organ. It's the organ that, is responsible for, synthesis of several, amino acids, which are called proteins, breaking down of proteins. Whatever you eat needs to get, some juices from the liver, which is the bile, which helps in the digestive process. The liver also has this process, it's called a detoxification, helps break down any toxins that you may have in the body in preparation for excretion through the gastrointestinal system. So the liver plays a very critical role in ensuring that you remain safe from any toxins that you take. It plays an important role in processing of medicines that you take, just to ensure that you're able to, be able to utilize medication and have digestion processes going on, and ensuring the core elements such as proteins and immune function of the body are at par.
Okay. Yeah. And before I cross to Mr. Shiranda, what factors contribute to proper health of the liver?
So the liver, by and large, requires that you lead a healthy lifestyle. A lot of what causes liver disease, could be considered as being infectious, could be considered as coming from what many people know as alcoholic liver disease. So avoiding excessive intake of alcohol is important to ensure that your liver is able to function well. Also, ensuring that you have proper food preservation techniques is very important, because we see some of the toxins that come and affect the body, are really attributed due to poor storage of food. Yes, so you have aflatoxins, which affect people, especially during such times when we have a lot of, maize, it's not stored well, cassava, all those have an effect on the liver. You also could get liver cancers, which, could be attributable to viruses. Some of the viruses include the hepatitis range of viruses, which you could acquire through poor, sanitation. That's for hepatitis A. If blood is not screened and you receive blood that's not screened, you could get hepatitis B. Drug use, which is injecting, could lead you to get hepatitis C and B. Yeah.
Okay. Let me just ask a question out of the blue. However, it's something I came across. Is too much intake of a certain food, maybe proteins, too much intake of protein, does it affect the health of the liver in any way?
It depends. That's a classic answer in medicine. Because you will generally overload the liver, working it excessively, but it still manages to get it out and digest it. However, if you're in situations where the liver is compromised, then yes, you could affect the status of your liver.
Okay.
Yeah.
Mr. Shiranda, let me cross over to you. Kindly tell us a little bit about yourself.
Well, it's difficult to say what I am. I'm a retired broadcast journalist who actually worked with the Kenya Broadcasting Corporation. I joined when it was still the Voice of Kenya. And currently, I am a peasant at home, engaged in community work. And I'm here specifically as one of the persons with that challenge in my family. One of my children, my son to be precise, Arnold Rapango, was diagnosed 2 years ago with a non-alcoholic liver cirrhosis. That's 2006, the third quarter, the last quarter of the year. And it was a challenge to the family. The boy doesn't drink alcohol, doesn't smoke. And then to find that is there, we all expected that the treatment will be through, and he joins us as a healthy person. But that was not the case to be. For 2 years, he has been in and out of the Aga Khan University Hospital clinics until late last year, December to be precise, when the doctors attending to him recommended that he goes for a liver transplant because it was in the end stage. So as we speak now, Arnold has undergone the liver transplant at Chennai Global Hospital in India.
In India.
Yeah. So I think that's what we are now.
Okay, there's something he mentioned, and I'll tie it with what you said, Daktari, that excessive consumption of alcohol affects the liver, excessive smoking does also affect the liver. But he mentions non-alcoholic liver cirrhosis. We're used to being told, ukikunywa sana, you get liver cirrhosis, but there's something like non-alcoholic, isn't it? Yeah. So in terms of manifestation, what is the difference between the alcoholic version and the non-alcoholic version?
Well, so the liver disease will show in a similar way for most of the conditions that affect it. You will see the telltale signs of yellowing of eyes. You will see distended abdomen, which really comes from the fact that the liver size is enlarged. Sometimes the liver shrinks. Some of the abdominal distension is also because of fluid that is accumulating in the abdomen, just because the liver is not able to effectively do its functions. Then you will notice also change in urine color because of one of the products made from the liver, and also change in stool color, as well as swelling in the limbs, swelling of the lower limbs. So you have swelling of the legs. Now, there's a set of conditions that do not necessarily follow the regular, what we call as the predisposing factors or the common things that people see. And in the medical fraternity, we refer to that as idiopathic. We don't know what's the cause. And one of the conditions that this we could highlight in this is one syndrome called the bad carrier syndrome. Bad carrier syndrome affects, the estimate is between 1 to 2 people in a million people population. So it's a very rare disease. It has no preponderance for either male or female, but what it is an obstruction of the blood flowing into the liver. And that could be caused by a clot in one of the veins or several of the veins that flow into the liver. And the liver will still show the same symptoms, just as a patient who may have been using alcohol or not using alcohol or affected by some other condition as well, but just show itself as liver disease.
Yeah.
So bad carrier shows also in a similar way. Now the only thing that is different is that it's caused by a clot. Sometimes you can distinguish the clots, but a clot to the blood flow into the liver, which makes now the liver distend, becomes larger. It causes fluid to accumulate, so you'll see the patient with a distended stomach. The doctors call that ascites. You'll hear that. They will have pain in the abdomen because, again, reduced flow into the liver causes pain. All organs require blood flow. So when you don't receive blood flow, the liver starts to die, and that initially shows off as pain, and then cirrhosis is really a dying liver, and that's really what necessitates, as along the way, sometimes for the replacement of the liver through the procedure where you require now another liver or a segment of the liver through the transplant.
Mr. Shiranda, when your son started manifesting symptoms, what was your initial reaction? Did you know it was the liver that had an issue, or how did you take it at first?
Well, he's an adult. We were apart until he was admitted at the Aga Khan University Hospital. We never knew what he was suffering. And it also took time for doctors to diagnose that was the disease. So when we discovered that was the disease and he was under medication, we were all optimistic that he will cure. Like anybody who gets ill, is treated, cures, and resumes his normal life. Okay. Remember, this is a boy who is married. He has 3 kids and is taking care of them. So when he went down, it became a social problem to us, the family. We have to worry about how to pay his bills. It's not a cheap disease to treat. Okay, the medications are very expensive. Even the diagnosis itself, because he's got to go to the MRI, ultrasound, biopsy, endoscopy, all this kind of stuff. So it called for us to come together, pool resources together, leave alone the financial, even the moral and the spiritual. This is to pray for him to recover quickly.
Okay.
Yeah.
And is it normal for it to take long to diagnose?
Yes. Yes.
Why so?
So, we say common things occur commonly, and bad carrier, for the way we've just discussed about it, is an uncommon disease. So before you make that diagnosis, it will require that a battery of tests are done, and it calls a stepwise approach, ruling out the common things first before you can come back to make this diagnosis. And you will be able to make this usually at tertiary centers where you have a lot of diagnostic capability. So you will be able to, look at a facility where you start with ultrasound. It makes you suspect, through the liver function test, try to make you suspect again through MRI. And when you look at all the findings that you get, that's how you're able then to make that diagnosis. So the delay in diagnosis is pretty common. And to get the right diagnosis as well requires a very high index of suspicion and a lot of expertise to be able to make this diagnosis.
As soon as you get to a position whereby a patient is diagnosed with this kind of a condition, they have to be put under medication. That's very true, isn't it?
Absolutely.
However, what other things should they observe, maybe in terms of lifestyle, in terms of diet? Does that change or does it remain the same?
So a lot has to change, actually. So several things. One, the diet is key. Patients who generally are on liver disease, who have liver disease, will go on low salt diet because they're not able to tolerate it very well. It also, you have to maintain a balance within the body of the electrolytes, so they refer to as electrolytes. So low salt diet will be recommended. Then part of the treatment requires that you're put on blood thinners. And that predisposes you to injuring yourself, even on very little, abrasions or something. So you have to be very careful around, having good footwear, just being very careful around where you sit, banging doors or cutting yourself because you could bleed for very long just because you're on blood thinners. Yeah. Then because of other complications, their medication they're put on just to ensure that their blood pressure does not rise, beta blockers, and all these come with an added lifestyle modification. The change in dietary habits, because of the distension of the stomach, of the abdomen, you're not able to take big portions of food. So they'll take very small portions of food over time, and avoid fatty foods because, again, the liver is compromised. A lot of the bile that's required to help emulsify the fat that you take comes from the liver. So when you don't have it, you have to reduce the amount of fatty foods that you take.
I'd like you to help me pass this microphone to Mr. Shiranda.
Sure.
He will be using that from now. It takes time to manage this condition. And you said that you had to pull together a lot of support, not only financial, but social and psychological and also emotional. As the patriarch of the family, as the head of the family, when it comes to psychological, emotional, and social support, what were the challenges that you faced, that you went through, that a viewer could be going through, and they need your experience?
Well, one is when you are told of liver transplant, many people won't understand it and won't believe it. They know about kidney transplant, which is very easy. So here, there's nobody who will buy to help you get a liver transplant. I mean, for grafting. So it's among you as a family to go through the tests.
Yeah, the mic a little bit up. Yeah.
To go through the tests and see who matches that. That's the challenge we had. One, even the doctor here, the brother, had to undergo several tests. Then there's another brother who is at Ben Gurion University in Israel, who had also to take similar tests. And so, luckily enough, they matched. Then, if the two go, they are all going to be patients. You are not going to hire somebody from the other side to employ them for caretaking. So one from the family has to do that. Now you have got 3 members of your family out in a strange land. It becomes very expensive. It becomes emotional. Then it comes to the operation, surgeries themselves. If you know that 2 of your children are going to undergo surgery, operations, you don't know the fate. You're a worried lot. Then 3, as a retired person like me, you lose contact with your colleagues who you worked with, who you socialized with. You are solo. Seeking for funds becomes a killing task. Because scratch my back, I scratch yours.
Yep.
What will you scratch from me? Nothing. That's difficult. So you have got to go back to what you invested in or you accumulated, sell it off. This hospital, Chennai Global Hospital, the initial cost was 50,000 euros, which is approximately Kenya shillings 6 million. Now, the surgery, the transplant for my son, operation took 16 hours. Then the brother, Francisco, the one who gave, was lucky. 1 week he was out, he had recovered. This one is still there. He had to go 3 other operations and long stays in ICU. ICU is extremely very expensive. That has shot up the bill from the initial 6 million we thought by another 2 million. And now, where we've reached, we're not able to pay for those services anymore. Then, the children have now to rent a house out, buy food, buy medication. Actually, as we are talking now, it is a situation that we will pay for the service before. Otherwise, they look at him that way. Now, the challenge we have is those people who are willing to stand with us. We even put out a pay bill number. We have sent out messages on social media, Facebook, WhatsApp. But maybe we can use this opportunity to mention that number.
Go ahead.
We have a pay bill number 714 777. And the account number is 0722 690 493. We're using that of my son here, Dr. Achwaka, because it's easier to get that money and send it to the hospital straight in India. This hospital administration in India, when they look at us paying, they're consistent with us that we are meeting it. Now, I'm also reaching out to those friends, relatives of mine, the people when I was in KBC here, who I also helped promote the activities, to reach me on 0722 82 66 21. The doctor might be very busy, so I can also give the explanations, and hopefully we can help get Arnold out.
Yeah.
Okay.
Our thoughts and prayers and well wishes are with you, and we shall stand with you in the course of your journey. But is there a chance, Dr. Achwaka, that someone offers to donate and then something goes wrong and there's a relapse? What are the chances of that happening?
Yeah, so thanks for that question. So before you actually go down and decide to do the transplant, a lot of background checks are done, tests are done. You have close to 20 or so tests being done just to ensure that this is the right donor, because It's a very big procedure to undergo transplant surgery. So what you're referring to is graft rejection, you know, and graft rejection is a real issue in transplant medicine. It actually happens sometimes. If the patient, in situations where the patient does not, for instance, continue to use immunosuppressing drugs, then the graft, the new piece that the patient has received, could actually be rejected by his body. So patients who receive, who undergo transplant have to be on immunosuppressive therapy for the rest of their lives. Yeah.
It's a lifelong treatment.
Yes.
And once I hosted someone who underwent a kidney transplant.
Yeah.
And they told me, when you're listening to the story, it may sound heroic, it may sound very romantic, but literally the experience is the total opposite. You could literally go through a spiral of life. So for someone who's willing to donate, for a family that is currently looking at the options of donating, what should they consider in terms of psychological and mental preparation for them to undergo this kind of process?
A lot of counseling has to be conducted, and you really have to be prepared psychologically on what the procedure and outcomes could possibly be. It's a difficult procedure. It's a huge sacrifice for the donor. It calls for a lot of love. But at the same time, people who are not in the medical field need to be alive to what challenges may happen. One of the complications is you could also not get up from theater. It's possible. And you need to be aware of that as well. You could get infections. You could undergo post-traumatic stress disorder, you know, where you're wondering, why did I do this? What did I do this? Fall into depression. So families need to be able to seek counseling for this, get proper information. Information is very empowering. All the time, if you can have the correct information with you, know what you're getting into, and be able to, you know, make decisions based on a position of knowledge, then that goes a long way in terms of supporting the donor. But then the donor also needs to have support around them, even once they're done with the procedure, just to realize that, you know, it's not an easy procedure. They've given part of their organ, and slowly be encouraged to get back into normal life. Yeah.
Back to normal life. Mr. Shiranda, he talks of being encouraged to go back to normal life. The transplant has happened, isn't it? How is the family? How is your son? How is the donor, you know, getting back to normal life? How is the process so far?
Well, we have gotten Arnold recovery on lab. So we get daily feeds from the caretaker. Luckily enough, my son Francisco Achwaka, who donated the liver for the grafting, recovered within a week. And he stayed on for 3 other weeks. So he's gone back to college.
Your microphone, please.
He's gone back to college in Israel. It's Arnold who is now still struggling, but he's also recovering fast. So the main thing is it's now taking longer than anticipated, because when we got to the hospital, we thought it would be about 6 weeks, 3 months or so. But it's now moving on. That's why it is the cost is escalating. Yeah.
Right. Daktari, coming to you, an opportunity to have a final word and address our viewers this morning, what is that clarion call you'd like to make, that message you'd like to leave with our viewers in as far as liver health is concerned?
Thank you. Just one quick thing. I think there's a big misconception that all liver disease is attributed to abuse of alcohol. That is a misconception out in the public that we really need to correct. There are a lot of causes of liver disease. The liver disease appears, albeit in a similar way for many people, but it should be the onus on us to be able to, lead healthy diets, ensure we take, we have controlled intake of alcohol, ensure that we get vaccinations where we need to for the hepatitis viruses that cause liver disease, as well as also appreciate that there could be other conditions that are idiopathic, such as this one, bad Chiari, and cancers where the causes may not exactly be attributable to the situation of the patient, or at least be blamed to the situation the patient is in.
Yeah. Over to you, Mr. Shiranda, your final word to the viewers this morning.
Well, to the viewers first, I must acknowledge KBC's support for the time they have given me to come and propagate to people to know that I have a sick son who requires their support. And if they didn't get the pay bill number, is 714-777, account number 0722-690-493, so that we can expedite this money to Chennai Global Hospital, to his account. And those who want to speak to me directly, meet me, they still can call me and reach me and support me through 0722-826621. God will bless you. I acknowledge your support in advance. And let's pray for Arnold to recover.
Yeah, our thoughts and prayers are with you. And gentlemen, thank you so much for coming and braving the courage to share a story that is right in your family. And we do wish you all the best in both your present and future endeavors. And we bring our discussion this morning to a close at that note. That has been Health Tuesday on this 15th day of May 2018. We do hope that you've been able to grasp pieces of information in as far as liver health is concerned. Kindly take note, all right? Prevention is always better than cure. So take note of what Dr. Achwaka said in terms of prevention, what you can do, what to avoid, and the kind of lifestyle you can embrace to ensure that you put yourself at, a lesser risk of getting any kind of liver diseases. However, he did say that not all liver diseases are not attributed to the consumption of alcohol. So that is very important, even when we think about how we embrace those in society that are dealing with liver diseases. Let us stop balkanizing and stigmatizing and thinking that, oh, ni msiba wa kujitakia. No, it's not for everyone. Okay, there are special circumstances that lead to conditions like these happening to a gentleman like Arnold, and I'm very sure there are so many others who are out there. So the pay bill number is 714-777, that is 714-777, and the account number is 0722-690-493. We know you're out there and you would like to assist this family in one way or another. Close to 10 million Kenya shillings. That is not an easy feat. So kindly we make an appeal to you. Help out, reach out, and you will be blessed. If you need more information, more detail in as far as this condition and the condition of Arnold is concerned, Mr. Shiranda's number is 0722-826621. you can reach out to him, and I believe he'll be in a position to answer any further questions that you may have in relation to this condition and the topic that we've discussed this morning. Good morning, Kenya. This edition of the 15th of May comes to a close. This discussion is off on air, but we can continue the same online, shall we? The hashtag is Good Morning Kenya. A link on this interview, as well as others that we've done before in relation to health and other topics, are available on YouTube. You can check us out. The channel is KBC Channel 1 TV shows, okay? And you'll be able to access these and much, much more. My name is Samuel Njoroge. How about you enjoy what is left of your Tuesday? We shall see you right here bright and early for yet another edition of Good Morning Kenya.